Okay. My name is Dr. Mohammad Akmal. I was professor of medicine and medical director of dialysis unit affiliated with University of Southern California for more than 25 years, and I have extreme experience dealing with kidney disease, and I'm currently professor emeritus of Keck School of Medicine in Southern California. And I met Vasandra Ragavan in 2006 when her son Aditya Ragavan was my patient, and she had donated her kidney to him in 1999, and she was extremely familiar with kidney disease and was concerned about her son and wanted to make other people aware of this particular problem. As we know, kidney disease is affecting millions of people throughout the world, and unfortunately, 80% of kidney disease is treated in only 20% of the countries. Majority of the countries which are poor are without dialysis treatment. We wrote this book to make people aware of the kidney disease and find the early recognition so they can go to the doctors. This book has many interesting stories, all kinds of kidney diseases, and how people met their challenge. I had a patient who was 90 years old, did not want to have a kidney dialysis. He did not have any other significant disease, and I convinced him, and he went on dialysis. He was 96 when he gave up. He was still in good shape, and during those 6 years, he traveled throughout the country, was camping and enjoying life. So, dialysis can help people who need them. Many people with kidney disease are not aware of kidney disease because there are 5 different stages. First 3 stages, people may not have any symptoms, so it can go unrecognized. So it's better to go and see doctor regularly and have their kidney function tested, because mortality rate in kidney failure patient is very high. If you look at people who are 55 to 65 without dialysis, their life expectancy is 22 years. But if they were on dialysis, it's only 5 years. That doesn't mean people cannot live longer. I have people who lived for 35 years who started young, and we have people who lived for 50 years. But these are not normal situations. People who are familiar with kidney disease and their family participate and they regularly adhere to their diet, medications, go to dialysis regularly, they do much better than those, because kidney failure has many complications. It affects every organ in the body from brain to bone and any tissue you name, heart. So they have to protect themselves by taking their medication regularly, participating in education, talking to their doctors, social workers, dietitians, and if they stick to their diet and treatment plan, they can do much better. There are 2 types of kidney dialysis, peritoneal and hemodialysis. Most people are in hemodialysis, and peritoneal dialysis and hemodialysis, both are good treatment modalities. Which is better, which is not better is controversial. But people who can do peritoneal dialysis themselves, they do much better because they are in command of their own treatment. I've seen people on peritoneal dialysis doing much better in 15 years. It depends on the person because you require total dedication to the treatment. Um, we in this book we have also discussed different diseases, how prominent surgeon dealt with it, lost his legs, but continued to receive treatment. Then we had a pharmacy student who continued to go through school and completed her pharmacy and become pharmacist. And she unfortunately had stroke and was in ICU for 2-3 months. Doctors wanted to give up, but I fought with them and we let her go, and she eventually recovered completely and is still practicing as pharmacist. So very challenging cases. We had people who were nurses and had cancer and did not give up, continued to be on dialysis, even though their lifespan was not long, but they enjoyed whatever life was available to them. In this book, we also have given them treatment plans, education about kidney disease, transplantation, and different diseases, particularly diabetes and hypertension. They're the two main causes of kidney failure, and they're like pandemic. They're all over the world, and these needs to be controlled. Otherwise, kidney disease is increasing disproportionately. Diabetes is very common. Unfortunately, its incidence is increasing very rapidly. In poor countries, people die of because of no access to dialysis, and I don't know what we can do for them. At least they can learn about kidney disease, try to prevent kidney failure by early recognition of hypertension and diabetes and controlling them. Our book also has stories about how people manage to learn about kidney disease and have met those challenges with courage and dignity. And this book is going to be good for all those who are in medical field taking care of dialysis patients, particularly nurses, social workers, and technicians. They can learn a lot from the book, and those people who have nothing to do with medical field, they can benefit by reading and trying to help themselves and their relatives. So this book has a lot to offer to everyone, whether they are in medical field or they are lay people, because it has dealt with kidney disease, transplantation, causes of the kidney disease, complication of the kidney disease, and people who had suffered through kidney disease and received dialysis and transplantation, pregnancy through dialysis, in dialysis patients also we have seen, and they require more care and more dialysis. And I have 10 people who had pregnancy during dialysis with normal deliveries. So there are many things in this book which can benefit most people, whether they are on dialysis or whether they're family of dialysis patients or they're nursing or allied health people or doctors who take care of such patients. And finally, I am very grateful to Vasandra. She's a great person. She's totally dedicated to these patients, and she's always talking about kidney, diet, and always in contact with me. And I learn a lot from her dedication and devotion to these patients. Thank you very much.